Senator Barrasso.
Thank you, Mr. Chairman. Mr. Secretary, thanks for being here today. I really applaud what the administration's doing in terms of focusing on making America healthy again. And we can agree that addressing chronic diseases is not a simple task. At its core, making America healthy depends on prevention. I believe that as a doctor, practiced a long time, was involved with the Wyoming Health Fairs, all focused on prevention. There is something called the U.S. Preventive Services Task Force. It has a 40-year history of providing independent, evidence-based recommendations on preventive care. It's part of HHS. And as a doctor, I've relied on these recommendations over the years. They've helped shape the standard of care across the country, from cancer screening to heart health. And I believe actually if more people followed the recommendations, our country would be a lot healthier. Last week, before the House Ways and Means Committee, you said you thought the task force had been lackadaisical and negligent for 20 years. I mean, they did a lot of good work on breast cancer prevention, cervical cancer, alcohol in pregnancy, and that you said you'd plan to bring on new members with a clear mission. So over the last year, they've canceled and not rescheduled multiple meetings of the task force. The department has. One of them was just on 3 days' notice. And I'm concerned that these actions show that we're not really prioritizing this important task force. So how are you demonstrating that you have a serious and consistent plan to reform the task force on prevention? And what exactly do you believe the Preventive Services Task Force has been getting wrong?
The task force is critically important. It plays a critical role in getting compensation, CMS compensation for important approved interventions. We consider that critical. The meetings were intermittent. I know I have not done a good job at getting the meetings out there. We are going to change that. And then we're posting applications that a number of the members are rotating out, and I think there's only 5 left. We're posting applications. We're going to get resumes. This week, we encourage people to send in resumes who are in all these different specialties. The number of specialties were not well represented on the committee, and we want to increase that to make sure that everybody is represented there, and to increase the number of meetings and also increase the transparency of the meetings.
In January of 2026, the addition of the American family physicians, a lot of physicians that practice all across the country read, they follow this. Dr. Doug Campos-Altkult raised some concerns about the future of the task force that we're talking about here. Particularly, he talked about the risk of undermining its independence and evidence-based methodology. And Mr. Chairman, I ask unanimous consent that this article I could submit to the record.
Without objection.
Thank you, Mr. Chairman. And I share his concerns because what we've just seen for the last year, the task force's methodology is grounded in an independent review of the evidence, careful evaluation of the benefits and the harms, and among so many health providers, it is widely been considered the gold standard for preventive care. So I hear what you're saying in terms of the different specialties and people rotating on.
I can promise you, Senator, we're not going to undermine any of those functions, and I don't think we'll get any criticism for doing so. We just want to get the best people and have a more representative group of specialties.
Okay, so you believe it's still the current methodology, the way they do it is still the gold standard?
I think there are some limitations that we are trying to address, and I'm happy to meet with you or consult with you to make sure we're doing it right.
Well, no, I'd be very happy about that. And then, you know, on vaccines, and a number of people have asked about vaccines. You committed when we visited in September to increasing transparency, to rebuild trust in the public health guidance. And since then, there have been some changes to the vaccination schedule, specifically with children. There have been some disruptions to the advisory committee on immunization practices. And I think that there's been more confusion for families and for providers, and I think sometimes it's very hard to keep up with some of the recommendations. So I'll ask you again, are you taking steps now to ensure vaccine guidance is clear, evidence-based, and trustworthy, and what those steps would be?
Absolutely, that's what we're doing. For the first time, we're going to be doing, for new vaccines that are not yet on the schedule, to make sure that they have safety studies, placebo-controlled trials first. And for the vaccines on the schedule, they're being reviewed. There's a limitation. I can't really talk about it because it's under litigation.
Thank you. Thank you, Mr. Chairman.
Support journalism you trust. Support PBS News. Donate now, or even better, start a monthly contribution today.